Well, good morning or good afternoon, depending on where you're joining us from. Thank you for being here and welcome to the Systems for Action Research in Progress webinar series. My name is Sadina Ben-Mishkan, and I'm a program manager with Systems for Action. We are a decade-old national research program funded by the Robert Wood Johnson Foundation and based at the Colorado School of Public Health in Aurora, Colorado. Each year, we release funding opportunities to support innovative research on systems alignment. That is, how do we better support and coordinate between medical, social, and public health sectors? Through this work, we aim to generate practical insights that improve health outcomes and advance health equity. Our bi-monthly webinar series is an opportunity to share emerging findings from our funded projects, highlight lessons learned, and explore how this work can be applied in practice. And we're delighted to be joined today by Dr. Maliha Ali and her team from the American Institutes for Research. In 2024, they were awarded a Systems for Action grant to conduct a one-year pilot study focused on strengthening systems alignment within Virginia's refugee resettlement process. And before I turn it over to Dr. Ali, a few quick housekeeping notes. This session is being recorded, and we will share the recording and the presentation slides with you afterward. And we'll have time for Q&A at the end of the presentation. Feel free to submit your questions at any time using the Q&A box at the bottom of your screen. And then with that, I will go ahead and hand it over to Dr. Ali to introduce herself, her team, and her S4A project.
Thanks so much, Sadina. Welcome, everyone. It's a pleasure to be here and to present our work under the Systems for Action grant. My name is Maliha Ali, and I'm the project director for this work. And I'm also a senior researcher at the American Institutes of Research. On behalf of our team, I'm really excited to be joined by my colleague Trinita Childers and project partners Siyung Burhe and Baktash Minocher. I want to turn it over to them to introduce themselves.
Hi, everyone. My name is Trinita Childers. I'm happy to be here. I'm a senior researcher at the American Institutes Research, and I live in North Carolina, and it's good to be here with you all. I'll pass to Siyum.
Oh, you're muted, Siyum. If you can come off mute, please. There we go. Thank you.
Wonderful. Thank you. My name is Siyum Burhe. I am the state coordinator for Virginia, and I live in Richmond, Virginia. It's a pleasure to be here. Thank you.
Hi, everyone. I'm Baktash Minocher. I'm an immigrant from Afghanistan. I came to the United States in 2023. I'm based in Seattle, Washington. From recently, I've moved here like a month ago, and I was based in Virginia, and I'm still working with an international development company based in Virginia.
Well, it's great for everyone to join us today. In this webinar, we'll be describing our Systems for Action project and the final product that we developed, an implementation guide. And then we'll open it up to Siyum and Baktash to do some reflections about their experience, give a commentary, and then turn it over to back to Sadina to moderate the Q&A. So Trinita, why don't you start us off?
Sure, thanks, Maliha. I want to start by just grounding us in where this work sits. The S4A project wrapped up in September, so we're about 6 months out now, and that distance has actually been really helpful. It gives us a chance to reflect not just on what we did, but what might actually last beyond the project. And I think that's really the spirit of today. Refugee resettlement is a shared responsibility across many different organizations working across these different systems: healthcare, employment, education, and social services. Systems alignment is a deliberate process that coordinates the work of independent systems and sectors, including the development of shared priorities and goals, governance and decision-making processes, financing and resource allocation approaches, and data and information sources, as well as coordinated implementation practices and policies. And really, in the end, better systems alignment can be extremely significant in improving the effectiveness of resettlement efforts. This was never really just about one program. It's part of a broader set of efforts across systems alignment, especially in spaces like housing and resettlement, where many people are doing important work, but not always in sync with one another. So this 12-month developmental study aimed to develop and test a new systems alignment approach by leveraging an existing federal coordinating mechanism known as quarterly consultations. So as we share today, we're really thinking about what's useful, what travels, and what could be picked up and adapted in other spaces. Quarterly consultations bring together many organizations representing several systems, including public health, healthcare, and social services. Led by state refugee coordinators in 50 states, quarterly consultations serve as a collaborating platform that regularly convenes partners in resettlement efforts. These consultations allow different representatives to be apprised of expected newcomer arrivals. So it really gives folks a sense of what kind of groups are coming, what needs might be arriving, what numbers social services might be expecting. And that way they can examine the local capacity to receive them, solicit input from systems partners and other receiving communities. These representatives are from the Departments of Social Services, Healthcare, and Public Health. They're also from school districts, public safety, resettlement agencies, and numerous community partners. One critical gap in these quarterly consultation procedures is the absence of an effective and sustainable participatory methods for cross-systems efforts, particularly in identifying and addressing bottlenecks in service delivery and policy implementation that might affect newcomers. There are many opportunities to make quarterly consultations more effective through meaningful two-way communication, building capacity for collective action, and particularly considering looking upstream at figuring out what the systemic barriers are that are preventing resettlement efforts from being more effective. So we'll take a moment to look at the role of the advisory panel in this particular project. We worked closely with an advisory panel, and we're so excited to have two of them here with us, Bakhtash and also Seyum. And that is representative, really, our advisory panel was representative of the different systems that we were working to align. So that way we could ensure that the design of the alignment approach is based on the experience of the people and the system representatives that are going to be using it. We have important partners who serve on this advisory panel, including the Office of New Americans, a state refugee coordinator, a health coordinator based in the Department of Public Health. In addition, we have representation from a resettlement agency in CWS, Church World Service, a not-for-profit, and two newcomers representing the lived experiences of refugees. The advisory panel worked closely with the AIR team in co-developing the systems alignment approach. The advisory panel informed all aspects of this work. We used human-centered design to develop and test the approach. So I'm going to take a moment to kind of talk through what human-centered design is for those who may be less familiar. Human-centered design, or HCD, is a creative approach to problem solving that really puts the experiences of people at the heart of the design process. So that way you end up with solutions that are tailor-made to suit their specific context and their needs. These methods enable the identification of unstated needs, structural barriers, and creative solutions that might otherwise remain hidden in a traditional planning process. This approach, the human-centered design approach, might especially be valuable for systems where power imbalances often exist between the service providers and the recipients. So that's one of the reasons why it was particularly useful when talking about refugee resettlement. So HCD is also useful where cultural and linguistic differences might complicate traditional engagement methods. Systems alignment fundamentally depends on effective engagement practices between people or adaptive factors, along with the structures and processes and enable collaboration. Those are the things that make HCD methods particularly suitable for developing effective alignment strategies. Human-centered design includes 3 iterative phases. The first is inspiration, the second is ideation, and the third is implementation. Each of these phases mapped onto the 3 aims of the S4A project. The inspiration phase is really about developing a deep understanding of the people we're designing for and includes building empathy by learning about their particular needs and challenges. We did this through AIM 1, which focused on understanding what systems alignment currently looks like in Virginia quarterly consultations and how it might be improved to address systemic barriers to newcomer health and well-being. That was part of the inspiration phase. Our team also conducted formative research that involved observations of 7 quarterly consultation meetings. Also, we conducted a focus group with the advisory panel, as well as key informant interviews. Then we moved from understanding the problems to generating potential solutions in the ideation phase. We engaged the advisory panel in 4 ideation meetings to review findings from the inspiration phase, then brainstorm ideas and design options as alternatives to the status quo. The ideation phase resulted in a prototype of the alignment model, which I'll describe in a bit. And the final phase of human-centered design is the implementation or testing a prototype of the solution by putting it into the hands of the people who will use it, gathering feedback, and then refining it. In this phase, we did the following steps. We conducted prototyping, we conducted pilot testing, feasibility testing, and lastly, we developed an implementation guide to support the quarterly consultations that would like to adopt this model. So I'll kind of walk through each of those, or actually, maybe it's best for time's sake that we just go ahead. So for the implementation phase, the alignment approach we developed is described as the Upstream Solutions Working Group. The approach involves the creation of a working group embedded within quarterly consultations that implements a set of system mapping processes and activities to identify and address systemic barriers to resettlement efforts. System mapping is a process that helps visualize how different factors in a complex system influence one another. So this map on the right of the slide that kind of shows the web of how different actors are connected to one another. That's what we were doing really with the systems and the system representatives themselves so that they can then get a visual of what they looked like when they were actually connected to one another. A picture is worth 1,000 words, and system maps do just that by creating a picture of how different parts of a system connect and influence one another. They really do show key factors in the relationships between them, including feedback loops that help us understand how a complex system really works. The Upstream Solutions Working Group can be implemented at the local level, so that could be county or city level, and the approach engages representatives who attend these quarterly consultation meetings from public health, social service, and human service organizations, as well as other invited experts to create a systems map together. Once we developed the prototype, we then tested it using a pilot Upstream Solutions Working Group. The specific resettlement priority we focused on was housing stability. So that is really what kind of anchored the web, the visual that we drew together. We invited staff from 9 different organizations representing refugee resettlement, community and housing development, property management, not-for-profit housing specialists, as well as housing advocacy organizations to participate in this pilot. During the pilot, the participants applying systems mapping steps to make a basic systems map. And this experience really helped us refine the alignment approach that we could then apply lessons learned from the pilot to develop the implementation guide. So once we walked through that entire system, we created the guide that Maliha will now describe.
Thanks so much, Trinita. So at the end of this project, we had developed a prototype that we're calling the Upstream Solutions Working Group. And we wanted to make sure that this endeavor that we had was adaptable and scalable and really feasible for other people to do this outside of Virginia. And quarterly consultations are actually happening everywhere in the country across many localities and regions. And so we realized, again, with consultation from the advisory panel, that practitioners, people leading these meetings, all of the different systems who are involved, they would really benefit from very systematic guidance that could enable anyone to actually take this model and put it to use and actually help them do what they're already doing in a more better and sustainable way. And so this implementation guide, and I think at some point we'll share that in the chat, it actually describes the entire prototype in a way that all system partners who participate at quarterly consultation meetings would be able to understand this, envision it, and actually apply it in a manner that's unburdensome. And I emphasize unburdensome because if you think about the day-to-day of people working in the resettlement landscape, they are quite stretched for capacity and time, right? Now, who isn't? They oftentimes wear multiple hats and they're pulled in different directions. And so creating a guide that was unburdensome was really a high priority, which meant that we had to really break down the steps for developing the working group, and that's described in the guide, as well as develop tools and actually examples to support implementation, because sometimes knowing the how can be difficult for people doing things the first time or actually changing things from what they're already used to. And so this guide includes an outline of a schedule of activities, like here's something you may want to consider if you're putting together a schedule that's congruent with existing quarterly consultation timelines. And so the audiences that are expected to benefit from this include state refugee coordinators such as Seyum and his team and his other colleagues, resettlement agency leaders and staff, and even community-based organization partners. This guide really serves as an initial step of introducing the Upstream Solutions Working Group approach for first-time users. And we've also included in the appendix facilitation guides and materials, because if you think about a working group coming together, a lot of folks may have hesitance in implementing this in terms of like, okay, how are we conducting these meetings? What is the agenda? What are the goals? And so the implementation guide actually drew a lot from the experience of our pilot to put together these materials that actually people could take and say, hey, we can actually hit the ground running. And we have a facilitation guide, we have milestones, we have a plan in place. All we have to do is actually play this game, just run through the steps and see what we get. So let's dig deeper a little bit into, So in the next few slides, I'm going to kind of go over some of the key features of the alignment model that are described in the guide, starting with the structure. Now, we knew that we didn't want to replicate the status quo, which is the existing quarterly consultation model, but we also wanted to kind of expand the purview of systems being represented at the table. And I'm just going to go back a little bit. So before we dive deeper, there are three objectives that really influence what we put into the implementation guide, and actually what actually then ended up as key features of the Upstream Solutions Working Group. The questions we asked were, how do we build a structure and process that really enabled shared understanding among the various systems that were represented in quarterly consultations? Second question we had, how do we create a participatory process that not only brings people on the table, it actually keeps them on the table? Because that was one of the gaps that we heard from the advisory panels, folks who should be represented, they come, but they don't come consistently. And we sometimes have, and that kind of creates obstacles in actually making changes that we think are necessary. And then the third kind of main objective was really offering participants of the working group something that benefited the whole group, but also the individual representatives in their unique roles, in their capacity, in their own organizations, which was also very significant for the consistency of the work of the working group and then sustainability. So those were the key parameters we kept in mind. And you will note as we kind of walk through the implementation guide, that the working group structure and process is really designed to achieve each of these. So let's start with structure. So the working group includes a core team and an extended team of invited experts. And the core team is really people who are very familiar with quarterly consultation procedures already, but they're also people who feel like, hey, we can do better. And so the core team includes the state refugee coordinator, the state refugee health coordinator, who sits with the Department of Public Health. It includes resettlement agency directors. It also includes newcomer representatives and refugee-led community-based organizations. And this core team is really responsible for the day-to-day planning, implementation, and meeting cadence of not just quarterly consultations, but of the working group. And it kind of really falls in their purview because they're doing this anyway. And so this group would convene working group sessions. They would facilitate outreach and communications to invited experts, manage data, and designate shared roles to newcomer representatives, and then leverage existing infrastructure and resources that are available to quarterly consultations. There is a second team, which is kind of like an essential part of the working group, but they don't have the level of responsibility like the core team. And this extended team of invited experts really includes representatives of systems that are implicated in some of the issues that the core team is grappling with. To help clarify that, for instance, oftentimes quarterly consultations, the top 3 issues that come up are housing, employment, and then oftentimes it's health or education, right? So these are the top priority systemic issues that there are lots of resettlement programs and lots of resettlement resources being used to address. And so the extended team of invited experts could include people that have a role in some of these issues, but don't have to be there as part of the working group meetings all the time. Like if the focus of the core team changes from housing to behavioral health, then that extended team of invited experts would also change. And so this team is really called upon to provide subject matter expertise, and they may optionally take on participatory roles during working group sessions, such as debriefing or co-facilitation. So that was the structure. Let's talk a little bit about what does the working group actually do. So we built out a process for them. It's a 5-stage process, which helps them get from a starting point to an end goal. And the end goal actually helps address the focus of what the core team is seeking to address, the core issue. So the first phase is launch. The second phase is system mapping, which is a cornerstone of the process. The third phase is, as a result of system mapping, you identify opportunities to address upstream barriers. The fourth phase is planning an actionable strategy. And the fifth phase is really engaging the system and the system representatives in the working group to act, learn, and adapt. And we included an example of how these phases and steps could actually pan out over a period of 12 to 18 months. And that's also included in a guide. And that also offers options to what are key activities that the core team is responsible for? And what are key activities that the extended team is responsible for? And we felt that having this timeline upfront for working group members really enables them to understand what's expected of them and make sure that they know what they're signing up for. So launching the upstream solutions group, sometimes the starting point can be the most challenging. And that's why the implementation guide has a lot of content, really breaking down what implementers need to be aware of as they launch the upstream solutions working group. So for instance, there's guidance on how do you develop the core team, how do you conduct outreach and engage invited experts? There's guidance on that. There's guidance on determining the schedule and frequency of working group meetings. And there's also information to support orientation and training of the implementers. And then in the end, we have guidance on how do you then start conducting these working group sessions. And for the interest of time, I won't go into details. Now, system mapping, I know Trinita mentioned this earlier when she was giving you an overview of the Upstream Solutions Working Group, and there's a lot of content in the guide about this, but system mapping is really the cornerstone of this working group's process, in which the working group actively gains clarity of the system in which they are, addressing their issue of focus. For instance, in the pilot, housing was the priority system that was identified. And so working group members then work through a series of activities that result in a visual system map. So these activities, and I've listed them on the left, which is they explore forces in the system, they analyze causes and effects, create loops to discover deeper relationships, and build the system map and iterate. And as I'm saying these out, they may sound extremely complex and as if people have to learn a new skill or a new technique. And what we learned from the pilot was, breaking these down into activities that people are familiar with in their day-to-day, but kind of piecing it together, as you're seeing in the photos, we enabled pilot participants to actually become familiar with the concept of system mapping through an in-person orientation before they could put it to use. So in the next few slides, I'm kind of going to walk you through on what that system mapping process looks like. So we bring the different sectors and systems represented on the working group. These are core team members as well as some extended team members. And in the pilot, like I mentioned, they were looking at the housing system. So you can see that, each of the system representatives is really deep in the weeds of the work that they're doing. And they often have a perspective that other people do not have. And so then they go through an exercise called exploring forces in the system. And this is really, again, built into the implementation guide. There is a facilitation guide that helps people go over this, which is determining what is really important in the system. What are some significant forces and factors that we think are important? And this is a really exciting time because people are bringing in forces that maybe other people may not have experienced or realized. So for instance, there are demand forces, financial forces, supply forces, regulatory forces, and power forces. These were kind of like the big buckets that showed up in our pilot. And as a result of that exercise, what happened was all of the people on the table, they got a fuller and clearer picture of the system, which equals shared understanding. So for instance, people realized that there was an issue with no credit history and no documentation for newcomers, which kind of prevented them from, having access to affordable housing. There was also a supply issue. So there was not enough housing for larger families, which oftentimes newcomers have large housing. There's health issues in terms of pest infestation. There's communication barriers. Sometimes tenants didn't realize what landlords expected of them, or they didn't really understand the fine print in terms of rent increases. So there was a lot of shared understanding being built as a result of that exercise. The next exercise is analyzing causes and effects. And that was really a really great way for people to understand what are some causes and what are effects. And sometimes they could see the effects becoming causes for another issue. Again, in the interest of time, I won't walk into this, but for instance, we did this for different themes. And one of the themes that you see here is property owners were really hesitant to lease to newcomer families. And we broke that down into why does that happen? And then what does that affect? And again, there were lots of aha moments around the table amongst almost all of the system representatives there. And then once people go through that, they do this creating loops to determine deeper relationships, which is actually taking those causes and effects from the previous exercise and kind of making a picture out of it. And these are the beginnings of the system map. And there were multiple system maps that were developed. And for folks who might be wondering, how did people do this? How long did it take? You can build in as much time as you need. Oftentimes, it doesn't have to be very fancy or polished, but the exercise of developing those loops actually reveals lots of leverage points and lots of assets or lots of gaps, systemic gaps in the system that are actually creating a lot of the issues and obstacles for both the system providers as well as the beneficiaries or the newcomers. And once you have a system map, like imagine having a picture and being able to figure out, hey, there's an issue up here that's causing an issue down here. And while everyone is putting in so much effort here, what if we could just fix this one thing here? And that's exactly what that system map enabled people in the pilot to kind of open their eyes to. It's like, all right, so now we have an opportunity. We've identified something that's causing a lot of the increased efforts that we're putting in now, almost repetitively. What can we do about it? And that takes them to strategizing. So I've just kind of included, this is a time for people to take a step back, look at the system map and saying, hey, first of all, congratulations, we built this together. 2, I really didn't know parts of this picture that really affect my day job are really important to me. And so there's a sense of like accomplishment and like, I'm so glad I'm being, I was able to take away something tangible from this exercise, which is what participants did express. And then there's this final piece of strategizing, which is, folks were like, now that we built the system map together and now we have greater clarity, what do we do about it? And so here are some quotes that came out from our pilot, which is people realized that there was a huge opportunity for resettlement agencies to kind of collaborate together and work with property management companies. There was also an opportunity to improve how newcomers were given their orientation in terms of housing. And there was also opportunities for community-based organizations to improve the ways that they interacted with resettlement agencies. And so on the right is just a snapshot of some of the information that we have in the implementation guide to enable strategizing. So the greatest hindrance to the success of the working group, we realize, is lack of or inconsistent participation from members, because the outcomes of this working group really depend on who's at the table, but also who stays at the table. And so working group dynamics and participation were really extremely important for the level of meaningful information exchange and insight that's essential to develop the system map and for the working group to achieve its goals. And so here are just some do's and don'ts to guide the engagement approach that we included in the guide. And so for instance, it is really important to have clear expectations, especially for invited experts, right? Oftentimes people do not want to attend these meetings because they're like, I don't know what I'm going to get into, and I'm not clear on what is the exit, like when do I get in and when do I get out? There's huge opportunity to share interim products back. So sometimes when you have a tall order and identifying upstream barriers in a system that was not created in the past 20 years, it's been there for a long time, it is a tall order and it can seem very intimidating. So breaking that down into like, here are some piecemeal goals and here's what you get back at every stage to participants is a huge incentive for them to stay on board. And then also evaluating participant experiences, hearing from them like, okay, to what extent did you enjoy this? Like really factoring in their enjoyment and what they are getting out of the experience is really important to kind of measure and adjust your approach accordingly. In terms of don'ts, we realize that people hesitate in participating in new things because they don't have the capacity to learn a new skill. And system mapping, it sounds extremely technical. It could be extremely intimidating that you feel like, okay, there's another thing I have to do and I have to volunteer for this working group. So don't overload participants. Organize orientations that actually are very, that kind of make sense to them in the role that they're actually playing. And turning it into a more, I use the word like a game intentionally, because oftentimes, there's this curiosity attached to system mapping that helps to engage participants in it. Do not neglect feedback and follow-up. I think that's a standard on any engagement activity. And then don't turn the working group meeting into just another meeting. Like, we want to make sure that people feel it added value And when they put time in, they actually got something in return. And so having those share outs or sending them back with a piece of the system map that they built is also really helpful. So in conclusion, as Trinita had shared, that we have had 6 months to step back from this and think about the value add. And at the end of the study, we feel that we really contributed something in the field in terms of implementation guidance that we hope that Seyum and his team can use at the Virginia Office of New Americans, and other people on Virginia Quarterly Consultations can apply. By engaging the very adopters of this approach into this work as part of the advisory panel to co-develop this approach, I think the value proposition for adoption is really strong. And I think by far the greatest contribution we hope for is really engaging and strengthening the voice and participation of newcomers in quarterly consultation spaces. And so to summarize, by aligning systems and bringing in that community voice into the room, this project can shift processes to achieve systems alignment in a manner that can really address structural barriers to resettlement and can enable the important resettlement efforts ongoing by representatives in quarterly consultations. And with that, I'll turn it back to Sedina. Thank you very much.
I couldn't find myself for a second there. Thank you so much for such an informative presentation. I would love to hear more from Seyum and Bakhtash about their experience and any learnings that they have that they'd like to share with us.
Thank you so much. If I can just share a few points. We have a very complex system called refugee resettlement. We also have silos in the system that don't always talk, don't always connect. And what that happens is we don't know what went wrong, why it went wrong. And this was a fantastic experience where we were able to open our eyes. It's almost like a medical system that does not include the patient in the discussion. I mean, that's how I can put it. And why are we not so successful in integration? We have people who are taking care of housing, taking care of employment, taking care of training, language, orientation, medical, everything, and it should work, right? Well, it's working, but not as smooth and interconnected. There are so many reasons that this project showed us. The map was miracle for me, just to tell you. I mean, if everything was written, I would like it, but I wouldn't love it. When I still have that map on my desk, I look at it like, okay, oh, now I know where that thing went off. The connection was not there. We now understand the system holistically. And I have been in this business for 28 years. I have worked on the ground. I was a caseworker. I was a manager. So I should know that. But I never connected it the way the system mapping showed me. There are breaks where I am really aware now where to connect, who to talk to, who needs to come together, specifically the clients themselves, because the community consultation, I used to run it when I was on the ground. I thought it was really fun. We heard everything positive, but I think I would have second thought how to do it now. So for me as a state coordinator, this is a valuable project where I can use it. Yes, I focus on housing on this, but I could use it for any project. Finding where things broke, finding who should be around, breaking the silos that always, I shouldn't say too much on silos because I work for the government and silos are typical system for us. But I'm very excited to have learned so much about connecting, about bringing people interconnection and looking at the weakest link and why did that happen. It's very clear now. when it comes to housing. I can memorize that. So yeah, I think when Maliha was talking about, initially I was like, oh God, another project. Do I even have a minute? I mean, I ran from one meeting to another, and honestly, but I am really glad I participated. I got a lot of it. And especially the map is going to be with me. I'm actually going to print a bigger one and show my team. So it was eye-opening is all I can say.
Even for me as a participant on this webinar, having the team talk about the project in theory, and then you see, we flash forward a few slides over, and then you see the map that was created. And I really appreciate the color coding, but how the different systems are related. And related to that, how can systems maps be reiterated or revised as an understanding deepens?
And I think we take this to any project, especially my area is refugee resettlement. So this is what I think. This is what I live. So if I take this project into, let's say, health, let's say employment, the system map is very similarly can be copied. It's the same breakdown that we would have to fix. So I think it would be, once you get the core value right here, you can move this into any project, because what you're bringing is all the players. The silo breaking is the biggest here. You bring those who are impacted. You have to listen to them, because if they don't participate, it's half of the issue. It's not complete. So I could use this in any project I'm doing. It's very clear on the housing, but it would be clear in everything else. Like, why are they not, like right now, we are in a whole new paradigm. Refugees are going to lose benefits after 4 months. And I'm going around the state trying to get ideas from the offices, and it's a difficult task. But we have to see why are we not getting out of the minimum wage into living wage, so that they get jobs that have benefits. That in itself, you can create really a map on that and find where the holes are, and bring all the players into and move these people out of that minimum wage. So even if the government is not going to provide benefits, at the very least, we can have majority of them being able to have a job with benefits. But there are many needles that needs to be interconnected. And that's how I look at this, using it for everything, especially now we're moving into state-centric resettlement. The responsibility of SRC will double, triple. So for me, this is a tool I'm going to need, to be honest with you.
And you have the AIR team behind you to back you up. So I'm glad that's
Thank you.
You have this in your pocket. We had a question from Ashish, and they had asked, could you show an example of a systems map? And I think that was earlier before you went through the slides. So, I feel that has been answered. She had another question. Could you talk about whether or how the systems approach enabled you to respond to systemic disruptions like policy or funding changes?
I can start us off, and then Siyum, if you want to weigh in a little bit. So we started this project very early in late in 2024, but by the time we actually got into the meat of the work, it was January 2025, and we had just convened the advisory panel, and that's when a lot of the rules regarding refugee resettlement changed, January 2025. For good or for worse, it was a time where we felt that the policy disruptions were actually ongoing, which motivated everyone, saying that the system is changing. We don't know how. Let's actually start figuring things out. And it's very hard to say how this map would change, but I think it enabled people to say that there's something we can do in the interim, because there was a sense of like, there was also a feeling of analysis paralysis. Capacity of resettlement agencies was really being shifted with a loss of funding, loss of jobs, loss of staff on the ground. And this is a time where leadership was really thinking that we've been following this system for about maybe 40, 50 years. Nothing has really changed. And this has been the biggest major shift, right? And this is actually, Seyum, I still remember you mentioning, it's like, the timing is working out really well, because this is a time where the volume of refugees is low enough for us to have enough time to think long term, the next 5 years, the next 10 years. So initially we were kind of taken aback. We were like, okay, everything's changing. How does this affect our project? But at the end of the day, it turned out to be very serendipitous, because this was the time where people actually were open to strategizing in a way that they had never done before, and we really needed a new systems alignment model. So that worked out. I don't know if I answered your question completely, but this is how I feel. The project was very responsive to the ongoing policy changes, and that are actually still ongoing on the ground. Seem if you feel like jumping on and adding anything to that.
I absolutely agree with you, Maliha, because I think we have to start thinking differently. As the policy changes, as the funding reduction becomes real, we even need this more, maybe. One, the two extremes are not very healthy for resettlement. With OAW, we were overwhelmed. We really could not think, just act, just really try to save lives, try to get somebody in an apartment. That apartment might not be ideal at all, actually, but a place to sleep in. We have to start thinking quality now. The second thing we have to think is empowering. I was talking about, and I think the previous speakers spoke about including the clients, the ones we are serving. Now we have to think empowering those clients. It is one thing to promise funding benefits for up to 5 years in certain area, 1 year of benefits. Well, that's no longer. We can't. It's one thing to complain, but we have to start thinking, okay, you know what? It is 4 months. What are you going to do about it? So we use this system to strengthen, to empower. Refugees are extremely creative survivors. I know that. So now we have to just be very honest, and orientation was mentioned. We started the orientation, giving the whole responsibility, unfortunately or fortunately, to the clients. You will be in charge. We're here to help you. But we're going to help you to help yourself. We're no longer going to do all those great things for you. But I'm not even sure philosophically those were great things. So I have my personal value challenge in me. So we have to start thinking differently. We cannot go back to the old days where things were easy. I happen to think in a long run, it is better to work really hard as a team with clients and to make sure they have viable, something that can be sustained, because donations and handouts from government is never sustainable. So for me, this is an opportunity to use this system, empower clients, be with them, try to do whatever we can. But look, it's not coming back. So we might as well rebuild this house that is falling apart. That's how I look at it on a personal level, to be honest with you.
Can you all speak more about how newcomers are recruited to participate, and more about recruiting and retaining them, as well as compensating them for their participation.
Yeah. Again, I'll start us off, and I want to kind of invite Bhaktash to comment since you stayed on throughout the project. Thank you. So this was a 12-month developmental study. Again, it was to create the model, and our advisory panel had 6 members, of which 2 were newcomer representatives who had recently arrived and who had kind of gone through the refugee resettlement system or were still going through. And we also had 1 newcomer-led community-based organization. So previously resettled refugee who was now leading her own organization and supporting resettlement efforts. And so Baktash and Shafak, both of them had recently arrived, and we recruited them through our, connections with resettlement agencies, where they kind of identified potential, people who would be interested. They reached out to some of their clients. They reached out to their staff. We had a small flyer with some information on what the project was about, if they were interested, whether to contact us. And so we conducted a brief interview. It showed that people were on board, explained the honoraria and expectations, and then we kind of recruited the people who were like most committed to the work. Bhaktash, can you talk a little bit about that? I know it was a long time ago.
Yeah, it was. One of my friends that when I moved to United States, that family had helped me a lot. They reached out to me and told me about the project, and they connected me with Malia. And basically, when I spoke with her and when I got introduced to the project, I was really really interested and excited because it was kind of both personal and kind of professional too, like being part of this team and working with the systems, and also personal level because I had gone through those challenges step by step myself when I moved to the United States, and I thought that I would be kind of helpful to share my experience, share my background, and what I went through with the team. And I think it was very, very productive and very efficient, the advisory panel and the upstream solution working group. And I loved how the team came together and suggested solutions, listened to the challenges, and build a system up that I think is one of I think that it describes most of the challenges regarding the resettlement and how the systems are interconnected with each other. So uh, this team, when I participated in the meetings, they were very supportive, very helpful, and they were listening, and that was very interesting and very amazing to me.
May I add, I just wanted to add, first, thank you so much, Baktash, for sharing that with us. And I just want to echo the importance of including refugee experience on the advisory panel and having those voices there. Not only does it offer a capacity building opportunity for the folks who are serving, they are learning about the U.S. systems in a, where, because refugees themselves are also integrating into U.S. communities. Not only that, they're connected with networks and meeting people and connecting with reliable information and resources. We have to understand that so much confusion and misinformation is happening under these circumstances where people are integrating quickly and it's a language they may or may not speak. So then you get reliable, quality information that then flows back into their homes, into their families, into their places of worship, their neighborhoods. I just want to kudos to Maliha and team for having that vision for the project to make sure that we understand that people are not islands. We are in communities, we are in ecosystems. So when we are plugged into information, it flows back out into the community and where it needs to go.
You did mention places of worship at Trinidad. There's a question that came in here. they're giving you kudos. You're a great advocate for systems-based approach. Did your systems map contain community organizations or faith-based organizations? Oh, and kudos to Maliha as well, from this participant.
I'm sorry, can you repeat the question, Sadina?
Yes. Was there in the system map, was there community organizations or faith-based organizations that were included?
Sure. So I just want to rephrase the question a little bit because the systems map doesn't include organizations per se. It includes factors that are associated with different organizations. But I think that's a really great addition that we can make on the map. Like I think areas or the areas of influence, which if we could kind of have an overlay. So thank you so much for the suggestion, an overlay of like, what's in the purview of your work? What is in your vicinity? And kind of have this overlay of colors showing which organizations kind of which factors matter most to which organizations and kind of help people see their place also in a way. So, but that said, what we did was we included community-based organizations on the advisory panel, and we included them on the pilot working group. So we had, and then these community-based organizations were actually worked in different spheres. So we had a community-based organization that was working in housing advocacy. And then we had community-based organizations that were working specifically with resettlement efforts in all aspects, not just housing. And then we had specific housing specialists that work for, again, not-for-profit community-based organizations. So those were the types of community-based organization. We did not include faith-based organizations in this specific pilot, but I would consider them having a very important role because a lot of the faith-based organizations, they have specific programs that are dedicated to refugee resettlement. And so the resettlement agencies that we work with, they oftentimes have affiliations with and community partners that are faith-based organizations. But it would have been really nice to kind of scale this project up if we had more time. But yes, definitely that is, those are organizations that should be at the table in what we are proposing.
Thank you for your response. We have time for one more question, and this is coming from Stacy Smith, who asks, can you share about some of the possible impeding factors to working with clients?
To clarify, when you mean clients, are you talking about newcomers, or are we considering people who would apply the alignment approach?
It's a good question. Let's go with the former for now, with newcomers.
With newcomers.
Mm-hmm.
So I won't speak from CIUM's experience, but what we heard on the advisory panel, some of the challenges were, well, first of all, everyone on the advisory panel agreed that it was important to engage newcomer voices on quarterly consultations. The way it's happening currently is people serving newcomers bring their, and these are like program staff at resettlement agencies, they oftentimes bring their anecdotes or issues that their clients have faced and those cases, and they bring them up for discussion at quarterly consultations. And there's like really common cases like so-and-so had an issue with housing, or so-and-so lost their benefits, or we couldn't get the documentation in. But what happened was like oftentimes, and this is again, the advisory panel told us that wasn't sufficient sometimes because it did not explain the causal factors or the effects of some of those stories. Like there was a lot of missing information or maybe, lack of representation of actually what may have led to that specific scenario. So again, a big focus on the downstream services and downstream effects of what could be an issue really upstream. And so the advisory panel did recommend that we would like to include more newcomer voices, but they also identified potential obstacles to doing that, oftentimes in the timing of quarterly consultations, enabling people to attend that especially when they may have working hours or they may need help with transportation. So there's just some really common challenges for newcomers to be on board. And then we did, we in the alignment model, we actually considered that and made options for attendance virtually. There's also, ways of compensating newcomers. I think there's no clear path, given that a lot of the funding for the quarterly consultations has to follow government procedures. There's probably no path right there. But again, this came up as one, there was a consensus that we want newcomer voices represented. We created a structure in the alignment approach to actually enable that. And then in terms of on-the-ground implementation, there's still some things to figure out on how that actually happens. Siyum, if you want to kind of add to that, I know we're a little over time.
No, I think you touch on the key issues. One more thing I would add is I want people to understand most of all the resettlement agencies have newcomers as their staff, most of them actually. What happens with the newest ones, which is really critical to include and get their ideas and their thoughts, becomes what Maliha talked about, employment. They're surviving, they're getting a job. We don't like to take them away. Secondly, we also want to be very careful to bring very few people into that group, and advocacy for individual needs can take over rather than the whole holistic way. So some staff members of mine were nervous about that. So we felt we had pretty new, I mean, they might have been here a year or so, but they were not the staff members, a lot of them culturally, linguistically, are very aware of the challenges because they are themselves recent. So it's a balancing act, to be honest with you.
Cool. Thank you so much for your response and for your time today. We appreciate the passion that you bring to this work and your perspective. Maliha, Trinita, Siyum, Baktash, thank you so much. And thank you all for joining us. We hope we see you again online next week, Wednesday, May 6th, same time, same place. We will include our presenters' email address if you have further questions for them. And we hope to see you next time. Be well. Thank you.
Thanks a lot. Bye.